You see that joint? See, Shabab, don't do any mistake in the lab exam. Make sure that you are understanding every point and you answer everything. It's not like, I don't know first answer, I will tell second answer, please. Each and every point is important in the lab. Name of the bones, it carries 1 mark. So mainly we are having 2 important bones. Femur and pelvis, first you tell like that. Then in the pelvis, 3 important parts. Ilium, ischium, pubis. Clear? Ilium, ischium, pubis. Pelvis and femur. So it carries 1 mark. How many joints are there? Mainly we are having 2 joints. 1 joint only, but tell 2 joints. 1 joint is hip joint. Articulation, how the articulation? The head of the femur articulates with the acetabulum fossa, and it is a ball and socket joint. One more joint is your sacroiliac joint, SI joint. So we are having 2 joints are there, hip joint and SI joint. So it carries 1 mark. So which is concave, which is convex here? Femur, convex, and pelvis, concave. Clear? Then femur convexity. Do you remember what is the femur convexity? What I mentioned you in the previous class. Femur convexity means femur is convex on the anterior side and posterior side it is concave. You can see here. Posterior side the femur is concave. Anterior side the femur is convex. Okay? Now, coming to the angulations. Angle of inclination. What is the normal angle of inclination? 125 degrees. Okay? 125 degrees. Normal angle. So it carries 1 mark. What is coxa vara? Angle is less than 125. Coxa vara. Angle is more than 125. Coxa vara. See, it carries 3 marks. Don't do any mistake, please. Normal angulation 125. If the angle is less, coxa vara. If the angle is more, coxa valga. Then femoral torsion. Normal angle is 15 degrees. Clear? Excessive anteversion. What is the meaning of excessive? If the angle is more than 15 degrees, excessive anteversion. Retroversion means if the angle is less than 15 degrees. See, in both these things, you have to remember one thing. If the angle is more or less, problem will be, what will be the problem if the angle is more or less? Dislocation or degeneration. Okay? Because of this problem, the range of motion will be affected, definitely. Dislocation or degeneration. And one more thing, what you have to remember here is, angle of inclination, the normal angle is 140 degrees at birth. When the baby, like in infants, 2 months, 3 months. Why the infant, the angle is more? Why the angle is more in small, maybe 1 month or 2 months baby, like infants? Because there is no weight bearing. As the child is increasing, the person will walk and weight will be there on the femur and the angle will come to 125. So please remember, in the infants, the angle is more, 140 degrees angle of inclination. And again, femoral torsion, in infants, the angle is 40 degrees. As the child is increasing, the angle will come to 15 degrees. So please remember, in infants, the angulation is more. As the child age is increasing, the angle will be decreased. Clear? Now, closed pack position, open pack position. What is the closed pack position? As I told you, this one. Hip extension, slight abduction, slight internal rotation. So it carries 1 mark. Closed pack position. Open pack, hip flexion to 90 degrees. The foot is away from the ground. That's it. Don't confuse. Open pack, closed pack. Clear? Then, what are the motions, planes and axes? We are having 3 degrees of freedom, flexion, extension, sagittal plane, frontal axis. Abduction, adduction, frontal plane, sagittal axis. Then external rotation, internal rotation. Horizontal plane, longitudinal axis. 6 motions, and you are having 3 degrees of freedom. Coming to the arthrokinematics. What is arthrokinematics? You have to remember here. Yes. how it is, whether it is femur on pelvis or pelvis on femur. If a femur on pelvis, convex on concave, rolling and sliding opposite direction. If a pelvis on femur, same side, concave on convex. Clear?
Yes.
So no need to confuse again. Please, femur on pelvis, convex on concave, pelvis on femur, concave on convex. The pelvis on femur is rolling and sliding, same direction. Femur on pelvis, rolling and sliding, opposite direction. Coming to the applied anatomy, hip arthritis. What is the meaning of arthritis? Inflammation of the joint or degeneration in the joint. Why the degeneration is very common in hip joint? Why the problem in the hip joint is more? Why?
More load.
Yes, because of the weight of your upper body and the trunk. Your upper body weight and the trunk weight first will fall on the hip joint. That's why the degeneration is very, very common in the hip arthritis. Fracture. What is the meaning of fracture? Any break in the bone. Why the hip fractures are common? Hip bone, your femur bone is the longest bone and strongest bone. When there is any fracture, when there is any accident or there is any injury, the hip fractures are very, very common. What are hip abnormalities? What is the meaning of abnormal? Abnormal means what? Abnormal means not normal. Like your coxa valga, coxa vera, excessive anteversion, retroversion. This all comes under your hip abnormalities. Clear?
Yes.
And one more thing I forgot to write here is lumbopelvic rhythm. What is lumbopelvic rhythm? Movement of the lumbar spine on the pelvis. It's called as lumbopelvic rhythm. There are two things: ipsilateral, contralateral. Ipsilateral, when you are bending forward and taking some object, your pelvis and spine will move in the same direction. Ipsi means same. Contra means opposite. Example, walking. So when you are walking, when your pelvis is moving in one direction, your spine will move in other direction. Contralateral.
Okay.
Clear?
Yes.
And one more concept you have to remember for all the things is flexion is limited by extensors. Extension is limited by flexors. Your abduction is limited by adductors. Adduction is limited by abductors. External rotation is limited by internal rotators. And your external rotation is limited by internal rotators, and your internal rotation is limited by external rotators. So please remember this thing. When you are seeing some ABCD or something, when we are asking you, don't tell the same. Flexion means flexors, wrong. Clear? So this finishes your hip joint. See, nothing difficult about